Hi Jen, thanks very much indeed for joining us again this morning. You've been a very popular guest on our previous webinars, giving an update on everything to do with the public health situation in Stockport. So thanks for joining us again. Can I just ask you if you could just explain what is the current situation in Stockport as of today?
Yeah. So over the last couple of months, we've seen quite a rapid rise in cases of COVID across Stockport. I'm sure most people are familiar with that. That rise has been exponential, which means it's growing and growing and growing much quicker, not just sort of steady away, but really rapidly, quite rapidly rising over the past couple of months. In the last week, we've seen, we're now up to an average of around 170 cases a day, so really high numbers. We've been in the region of 450 cases per 100,000 for the last few days. Yesterday our rate dropped to 407 per 100,000. That's the latest figure, and that's predominantly because one day, 8 days ago now, we had a particularly high day that was just really pulling our rates up. So that drop doesn't mean we're necessarily declining, it's just we've had a slightly more steady week. So rates have steadied up somewhat in the last few days, but when we've seen that before, the rise has then started again. So we're not getting too complacent or reading anything into that just yet. I'd like to see a sustained period where that is more apparent for us to make any conclusions. We've seen rises in all age groups. So over the last week, the sort of 1,200-ish cases that we've had over the last week, about 20% of them are in the 17 to 29 age group, about 35% are 30 to 49 age group, about 28% are 50 to 69s. And we do know that over 60s translate more readily to hospital admissions, so cases in that age group are of particular concern to us, and that has been rising steadily over October. We have seen an increase in cases in hospital over recent weeks. There's always a bit of a lag between the cases being identified, the rise in hospital, the rise in critical care, and then a further lag to the actual death rates that result. So we do expect further rises in hospital cases. We do expect some increase in the critical care uses, and we do expect some deaths resulting from the increases that we've seen over recent weeks. The cases that we're seeing at the moment are spread across Stockport. So I've given you a bit of a breakdown of the ages we're seeing. So really predominantly all ages, particularly across that working age adult population. Ethnicity wise, the trend's similar to our population. So nothing striking about that demographic, and geographically we are seeing cases spread across all of the wards in Stockport. It does vary slightly week on week which is our highest ward and which areas are higher, and people can have a good look at that data on the national portal where you can really interrogate the data and look at, there's a map where you can see, I think we've shared the link previously, we can always share that link again, have a look at the different areas and the rates in those different areas. We are seeing a fair number of outbreaks in particular settings, and there's a whole range of different settings where outbreaks occur. We manage them, and we use the same process whatever the setting, which is to really understand who those cases are within that setting, where and how transmission might have occurred, and therefore is anybody else at risk, and is there anything else we need to put in place to control the spread within a setting. So that might be care homes. We've had a few schools, predominantly just cases relating to schools rather than big outbreaks, and a few other settings as well, so a bit of a mixed picture. There's a few different data sources that we use, and in terms of the cases, back in March, people were only being, March, April, May time, people were only really being tested if they entered hospital. So the case count was a lot lower. Even though there were lots more cases happening, we didn't know about them in the same way. We weren't counting them in the same way. Since about early June, end of May, beginning of June, there's been widespread access to testing, and that's continued. We're testing high numbers in Stockport every day. So testing is there, it's available, good access and good turnaround times at the moment is the feedback we're getting. There was some issue with that sort of mid to late September, but that seems to have resolved now through later October and into November. So I would encourage people, if they've got the symptoms, that's a cough, temperature, loss of smell or taste, or change to smell or taste, please do get booked on. It's easy to do. You can book on gov.uk and just a quick Google gets you a link to to book a test. And we've got sites in Stockport now. It's really easy to get access to testing at the moment. So that's definitely increased and improved since the March time. We've also got more data coming through now about the settings and where we're seeing cases. And as it's been the case throughout this September, October rise, that we are seeing cases that link to settings, and we're seeing some outbreaks in some settings, but there's a real mix. We are seeing definite community transmission, which is hard to pin down exactly where that is, but we do get some data through about people's contact, who they've been in contact with, and also the settings that they've been to, or where we see specific outbreaks within a setting as well. So we use all of that, kind of put all of that information together to give us an understanding of what we're seeing, and to then direct teams, like we've got a pandemic response team who can go out and work with businesses, work with workplaces to understand what their issues might be, what the challenges that they're facing, and give them advice and point them to the right guidance and that sort of thing.
That brings me nicely onto the next question. We're talking about today, we're seeing new restrictions brought in. How important is it for people to follow these new restrictions in order to reduce the case numbers in Stockport?
Yeah, it's really important. We know that's a huge ask. It's a huge burden on people, the restrictions. It's really tricky, it's really challenging. But we have to work together to make this change. And it's so easy at this point to feel a bit fed up with it all. There's been changes constantly. It's hard to know what you can and can't do. I recognise all of that, but it really is important that we bring this case rate down now. That rise has to stop. We have to find a way of getting that under control. And I think the restrictions, whilst really challenging, and it's not that we don't recognise that, but it really does feel like that, we have to comply with them to see that change now come about. So as tough as it is, we're really asking people to take it seriously. Every step we take together in the right direction is going to have a positive impact. It might feel like small steps, but all of those things add up. All of those small changes that we all make, remembering your mask, remembering to wear your face mask, cutting back on who you're seeing, and now that's obviously restricted through this second lockdown. But all of those behaviours will be needed when we come out of the lockdown and have a little bit more freedom as well. We need to keep that social distancing, the wearing of face masks in indoor settings, the hand washing. We need to keep all of those things going. It's not one or the other. It's not lockdown or these things. It's all of these slight behaviour changes that we need to make. And one of the biggest ones is the isolation. When you're symptomatic or have been advised to isolate because you're a close contact of somebody who's positive. That really helps, that process of isolating people who are infectious or who are about to become infectious. That process really helps. So I would encourage people to not only comply with the restrictions, but to really comply with the track and trace advice as well. If
you've already had coronavirus and you've been diagnosed with that, and you've followed through and you've isolated and you've come out the other side, can people like that still transmit the disease? How important is it for those people to still follow all the guidance that's being issued?
Yeah, it's really important because we don't know enough yet about your chance of being reinfected, if you can still be infectious despite having had it yourself. There's a lot we don't know about. We're getting more and more information about the chances of you having some level of immunity, but we don't know exactly how long that lasts. We can't say for definite that you're going to be immune for 6 months. We don't have a figure like that we can confidently apply. So as tough as that feels, it's really important that everybody follows that advice, no matter if you have had a previous confirmed infection or not, just until we know more until we can answer those sorts of questions with robust scientific evidence behind it, which we're not at that stage yet. It's emerging and it will come, and it will then be able to help us answer those sorts of questions more in the future. But at this moment in time, we've got to act in the same way regardless.
Mental health, it's really, really important. And I noticed that there have been some changes to what you're allowed and not allowed to do this time, that we were more restricted in the first lockdown 1.0, if you like. So how important is it for people? How can people make sure that they still protect their mental health and their well-being, as well as following all the guidance? What advice would you give to people to try and maintain that mental health, healthy lifestyle?
It's such an important question, Helen. It's so important to us that we do those things. Getting some physical activity every day, that's completely allowed, that's completely within the guidance. Absolutely encourage everybody to do that. There's a number of resources on the website. I think you've put them on the SK Recovery website as well as on the council website, that give people all sorts of tips and hints. It's about making sure you're planning your day, thinking about the purpose within your day, being kind. We've all got to be kind to each other at the moment. Everybody is struggling with this, and I think the more we can think about how each other's feeling and just take notice of that, and offer some kind words, asking how are you, how are you feeling today, and just giving each other a bit of space, a bit of time to have those sorts of conversations. You don't have to hold and fix any difficult conversations that come up. You can just allow them to be, but giving each other time for those conversations is really important. Keeping connected with people, keeping connected, whether that be through some of the things that are allowed, but also using the digital solutions that we've all come really comfortable with now, I think, or at least more accustomed with, using those things to stay in touch. And just a phone call can be make a massive difference to somebody's day. So just keeping in touch with people as much as we can't necessarily do that in person, but using those digital solutions to do that. And as I say, the physical activity, structuring your day, and at times avoiding the news and things like that when that's just feeling a bit too much. You don't have to stay in touch with that rolling news cycle. It can be a bit overwhelming at times. As I say, there's some more information on both the council website and I think on the SK Business Recovery website as well, with some more of those top tips. We've also pulled together a leaflet that has all of the different sources of additional support. If you're particularly finding this challenging, whether that be from an emotional well-being perspective, whether that be you're struggling financially, whether that be there's some relationship difficulty, there's a whole host of things that I know people will find particularly challenging. So we've listed all the different service offers that are available there, that if you're just feeling that need for some additional help.
What can employers within our area do to make sure that they maintain the mental health of their employees?
Yeah, I think, well, firstly, recognising how hard this is and really supporting people when they are asked to isolate, being very supportive of that, and understanding that people will not necessarily want to do that, will find that to be challenging, but the more we can support each other with that, the better. I think allowing for breaks and break time that people are getting preferably outside in some fresh air, and preferably a bit of physical activity built into the day would be really positive. Allowing that time for connection and sharing that, sharing how people are feeling, whether that be positive stories, finding ways to share how people are feeling at this time. I think some good tips.
The latest guidelines show that you can actually meet one other person with your child if they're under preschool, or children under preschool age. How important do you think this is to maintain this sort of mental health and make sure that people don't feel too isolated?
I think it's an important shift, isn't it? Because last time that wasn't allowed, but it's one other person from outside of your household, and it's a one-to-one, so it can't be your whole household plus one other. It's one person meeting one other person, and as you say, it's important that this time the preschool age and below, young children don't count in that interaction, so that enables young mums and new mums to get out and meet others, and go for a walk, or it's all to be outside in a public place. So, but it's a really important way to connect, a really important addition, I think. So that might be going for a walk with another mum, or another dad. Might be getting out just for some fresh air every now and then, but those steps are really important.
And are the children allowed to play together?
Well, at all times, social distancing is.
If you're meeting somebody on a one-on-one basis and you've got preschool age children, is it okay for the children to play together?
Yeah, well, I think that's one of those inevitable aspects. We do ask everybody to maintain social distancing at all times. That's something we're all trying to adjust to. I think with that age children, they seem to be, and the evidence is still emerging on this, but they do seem to be less involved in the transmission. But as I say, evidence still emerging on that one, and I think it's one of those things that is almost impossible to stop. So it's one of those, not explicitly in or out of the guidance, but one of those things that we kind of understand will probably happen. I just would encourage people not to chalk up too many contacts in any one period of time, any close period of time. So it might be a good idea to sort of buddy up with somebody that you're going for a regular walk once a week with, or something like that, rather than trying to see loads of different people using that particular rule.